Well, good afternoon. I want to welcome everyone back for our series celebrating giants of physical therapy in Kentucky. I'm excited about today's episode in that we're able to host our next giant in physical therapy, Dr. Susan Effgan. So we're excited to hear a little bit more about her and her work over her career. She spent over 25 years consulting, researching, educating students, and practicing clinicians, as well as doing publications related to children with disabilities around the United States and abroad. So we're excited to hear a little bit more about that work, as well as what she's done for the APTA. But before we jump into that, we will have a little spotlight promotional here. I want to remind everybody to take time and register for our virtual fall conference that will begin this Friday, October 1st at 6 p.m. And then Saturday, October 7th, we have some great speakers that will be talking on the topic of clinical practice guidelines in orthopedics, neurology. We'll have vestibular speakers as well as cancer care. So please join us by signing up for Friday, October 1st, that begins at 6 p.m. for our research presentations. I also want to remind everybody that we have a silent auction that's now open beginning today, September 27th. So if you go to aptakentucky.org and click on news and events, you'll be able to see what kind of silent auction items we have on the tab there. You don't need to attend the conference or be present to win. So it will close, though, Saturday, October 2nd. So after confirmation of payment, we'll be able to get those items shipped out to you. So without further ado, we're going to turn it over to Beth Ennis to tell us a little bit about our 100 days of service first, and then we'll be able to hear her dialogue with Dr. Susan Effgan.
Thank you, Charlie. I just wanted to remind everybody that we are still celebrating our centennial. We had our huge ceremony in DC at the beginning of the month over the September 10th weekend, but we are also now in our 100 days of service. So if you are doing community service projects, please keep track of them. Let APTA know on the Centennial site what you're doing and help us continue to round out this celebration. It is my great privilege to bring Dr. Susan Effgan in here so that we can have a chat. I've actually known Susan for quite some time. We're not going to age either of us by saying how long, but welcome, Dr. Effgan. Would you mind starting us off by talking about what motivated you to get into PT to begin with and how that kind of guided your direction over your career?
Certainly. I want to comment to Charlie. It's more like over 50 years in PT, so it was a long time ago. I just volunteered at a hospital and looked at a PT department and thought, this sort of meets my needs. Maybe I could do this. And it went on from there. So there wasn't any epiphany. I wasn't injured, but just found it interesting. How I got into pediatrics, same thing. I loved all areas of practice, especially neuro, but the teaching part came in graduate school where, there's a shortage of peds faculty. And if I was really going to make a difference in getting more people interested in pediatrics, we needed faculty. As we do today, 40 to 50 years later, there's still a shortage of peds faculty. And that's the only way you're going to get future generations involved is by having on-site, not via Skype, not some outside 2-week consultant, but having peds faculty in-house. So that's a real important issue for me, is training future faculty.
Absolutely. I was also fortunate to know you before you came to Kentucky. We were discussing a little earlier that you and I moved here about the same time, but you had quite a career before you came to Kentucky, mostly in the Philadelphia area, but for a while before that in other places as well. And you've also done a ton of work related to advocacy. Would you mind sharing some of that experience? Because I think that's a piece that most students, most PTs don't get as involved in as they need to. And you've made some amazing change due to your involvement.
Advocacy, lots of people are involved for different reasons. Some have a family member and they get involved in advocacy with a certain disability. That wasn't so much me. I was just diligent. I wanted to help children with disabilities. I went to CSM as a young faculty member in 1977, folks. I'll admit that. I'm there at that meeting, and they talk about this new law, the Education of All Handicapped Children's Act. Brand new. PT knew nothing about it. The definition of PT in that law was the treatment of atrophied muscles. Now, we do more than treat atrophied muscles. So the whole group of us there said, we've got to come up with a new definition. So we all try to figure out what's the definition in the law. Now, this is telephones on a weekend, not getting much information. Decided that OT had the answer. It should be they were there by a licensed occupational therapist, and not all this stuff about the machines we could use. And most practice acts were machines. I lived in Atlanta, and on that Tuesday, there was a hearing in Atlanta. And since I lived in Atlanta and I was involved at CSM, go speak. So that's how I got involved. Is I was there at the right place, right time, wrong time. And then because of that, spoke in other hearings and places about the definitions and about some other changes we wanted in the law. And the good thing was they listened, they made the changes. And that's really reinforcing when what you're advocating for gets changed in the law. And so, and you learn to read a law. So having learned to read the law when it got reauthorized, I was already there and can continue that reading. And Beth may remember in 1995, they took out related services from that law, and that got all of us just really alarmed. And we had the parents back then, and that's the big issue. The parents supported us from the beginning when they took out related services from the law, and then, okay, no related services, the parents are there. They and us advocated, and I got a section on pediatrics to fund a lobbyist, hired a lobbyist, not in my normal daily routine, but got a lobbyist who was wonderful, and we were able to get some very positive things done for what I consider a very positive law. I think this is a very important, useful piece of legislation. My concern for the future is that parents don't understand what it was like when children with an intellectual disability were not allowed in schools. Physical disabilities, if you couldn't walk to the bathroom, you couldn't go to school. So times have changed, and parents don't know what they could lose if this law gets radically changed. So that's really been the spiral. It's reauthorized every number of years. It's been since 2004, so I haven't been too active since I've been in Kentucky because it hasn't been reauthorized. But
I was going to say, I think we're due.
We're due, but we didn't want to renew it in the past few years because we're really afraid of negative changes. Right. So we're just keeping it going as it is.
Absolutely. Is there any advice that you would give to our young clinicians, to our current students, to our seasoned clinicians who haven't gotten that engaged, as far as what they should do beyond just the treatment of their patients as part of the profession?
Back before we were a doctoring profession, people went to graduate school for specialization, and 2 solid years of advanced pediatrics, orthopedics, neuro, whatever you liked, but you were trained at a much higher level with much more skills. And we miss that today because the residency isn't the same. It's much less than those 2 years of graduate work with a research project. So I think that's an ongoing loss to the profession. But I would encourage our clinicians to really read those books. The books tie everything together. Read them, get advanced competencies, get your specialization, whatever your field. And by doing that, you cultivate an interest, you become more of an advocate versus working in a PT factory where, everything's the same. You're not using your mind. It may be simple, but you're not going to be challenged. You're not really a professional because you're not growing the field. Participate in those research studies that your researchers want you to do. Fill out those surveys, for Pete's sake. Anyone can fill out a survey, but it's helping some future researcher get some information, because we're not going to last long as a profession without new and important research. We've got to support our research efforts. And that to me is the long-term concern, is if we don't support our research, the profession really is not going to move ahead.
Absolutely. Is there a highlight moment, a special moment, point in time that jumps out at you that was really meaningful to you?
I guess I'm at CSM filling out the PAC forms, writing it out, and I'm hearing someone getting an award. That's nice. I'm writing, whatever. And all of a sudden I realize, oh, that's got to be Lisa or Bob. And I keep listening to it. Oh, that's me. Well, I got an advocacy award, which was wonderful. But what was very, very special and shocking is that it's now in my name. Absolutely. And that was like, wow. You do advocacy, you never expect to be rewarded for it. And then so that was probably the most singular important moment.
Well, and I was fortunate to be there that day, and I will say that it is very well deserved, and continues to be given to some amazing people who are doing good work following in your footsteps. So I think that's appropriately named for that reason. Did you have any mentors, any folks who were instrumental in guiding you, motivating you, moving you along your path?
Just initially, I went to Boston University, and there are some real leaders there. The dean came to my wedding, for Pete's sake. There were a wonderful group of leaders, and they're all passed. So, they're gone. You all won't know them. But I was involved in student government. I was a student government president. So I'd go to the faculty meetings and stay and learn from these true leaders to find out what a functioning faculty looked like. Nancy Watts, a leader in the APTA, turned down tenure while I was there. And I realized, wow, she couldn't stay at the university when you turned it down. Mm-hmm. But because she didn't believe in tenure, as now I don't, I never have, because of Nancy Watts, you learn from those true leaders just by watching and listening. And Nancy, of course, went on to start the program at Mass General, but she was a leader in doctoral education of PTs and really encouraged me to continue along that path.
Wonderful. Well, I appreciate your time, Susan, tremendously. And I know you've just been traveling, so the fact that you're here with us with all the energy that you have is amazing. I hope that you're not done yet. I know that you're officially retired in emerita from faculty work, but I know that there's a lot that you have still to do, and hopefully we can tag along and help you on the way. I am going to pull Charlie back in to wrap us up, but thank you again so much. And Charlie, I'm going to kick it back to you.
Well, I was trying to be generous with Dr. Effgan there to say over 25 years. So I want to make sure that we clarify she added the 50 years in there, but we're very inspired by her passion to grow the field, especially in research. So we thank you, Dr. Effgan, for the words. We could listen to you all day, but we appreciate your time, and congrats for being a giant in physical therapy in Kentucky. So we invite everybody back to join us again for our next Giants in Physical Therapy to see who's up. Have a great day.